Welcome to Pharmative Live, the premiere of Season 3. I'm your host, Dr. James Partylk. I'm a clinical pharmacist, I'm a cancer research scientist, and I'm also the founder of Pharmative.com. And this is Pharmative Live, and we're coming to you live from our digital recording studios right here in Palm Springs, California. Pharmative Live is all about our time to interact with each other. So please feel free to text me questions. Please also feel free to send me suggestions and questions ahead of time by sending us your questions to info@pharmative.com. And then Pharmative Live, all of our videos are then downloaded and placed on pharmative.com, as well as our YouTube Pharmative page. And you are able to download on demand all of our programming. I think right now we have over 200 healthcare educational videos on Pharmative YouTube and Pharmative.com. And Pharmative.com is a social media platform which connects patients with healthcare scientists and doctors to educate ourselves, to exchange information, to ask questions, and so forth. And membership is free. Pharmative Live is also sponsored by PNN Plus Health mobile app. You can go to your app stores and download our PNN.One Plus mobile app. And not only does it provide to you rock and high beat music, entertainment, retro TV and cartoons, classic films. It also has our online magazine, PrideNation.com, but it also has a lot of healthcare resource tools that I find would be extremely valuable for you and your family's healthcare. So we have a symptom checker. It's actually a chatbot, and that is provided to you by your MD. And you enter your symptoms, and it will give you a differential diagnosis that you can discuss with your healthcare team. It also has drugs.com from the FDA. You can look up standard dosages and side effects of any drug which is FDA approved. We also have information from the CDC, the Mayo Clinic, the World Health Organization. You can even get the weather from your PNN Plus mobile app. You can also access Twitter as well as Facebook and Google searches. So I love the app. Jimmy loves the app. Ellen loves the app. And I'm sure you're going to love the app too. There's limited commercial interruptions on our mobile app. So before we discuss our topic today, which is a COVID treatment update and vaccine development update, I'm going to talk a little bit about technology. And this is just our way of basically trying to assist in educating people how streaming devices are so easy to use. Now, oftentimes we will advertise some of our programming, which is available on Roku at no cost to you. It's also available on Chromecast. You can also enter into any web browser our magazine, PrideNation.com, our radio station with our great music at PNN.FM. You can go to PNN.One and get all of our channels, including Alan Edwards Talk Radio. And you can also retrieve a great deal of information through, and I'm trying to think of the fourth website, so Pharmative.com, which is our healthcare social media platform. So all of that can be accessed through one place, PNN.One, or through our online magazine, which has all the channels there at PrideNation.com. And all of that content can be retrieved through our PNN.One Plus Health mobile app. Now I'm going to talk to you a little bit about streaming devices. Streaming devices like Roku or Google Chromecast, and there are a number of others. How easy it is to hook up to your flat screen. Some of the newer flat screens come with the software already installed. But what I'm going to do is show to you Roku okay, which I have set up here, what a small device it is. And all you have to do to activate a Roku device, which costs about $36 plus or minus some, is plug it into an electric outlet and then plug it into a port in the back of your flat screen. And then you would use a remote like this that will allow you to activate your Roku. Roku comes at no charge to you. And there's a great deal of content available on Roku, including YouTube, and of course PNN.One, which is located by looking up our original broadcasting name, which was KLPS-19, Proud TV. And I'm going to show you that. And you're going to see how much content you can get. All you need is Wi-Fi signal. So what a lot of people are doing now is they're ditching their cable, they're ditching their DirecTV, their Dish TV, their Comcast, and all those other cables, and they're making sure that they have a good Wi-Fi signal, and they're using streaming devices like Roku to be able to search for on-demand programming. So when they talk about like linear brand programming, that's like a broadcast signal like NBC that's just streaming broadcasting, but you can't control easily, unless you're using a recorder, the signal. It's just linearly being broadcasting. All of the PNN content is digital, and it's all located on computer servers, and it's all available on demand, and you can watch it at your convenience, at your time, at your leisure, and so forth. So hooking up, again, the Roku device is just plug it into an electric outlet, plug it into the back of your TV, and you're good to go. Now, the one thing that gets a lot of people messed up, on your TV remote control, there will be usually in the upper right or left corner a button that says input or source. It's either called input or source. And that allows you to switch from one port to another port to another port. So you may have, for example, a cable port, Comcast or DirecTV. That's one port. You may have a streaming device, Roku. That's another port. You may have a DVR. That's another port. And the input or the source button allows you to switch from one versus the other. Okay, so you turn your TV on, and then you go to your input source button, and you select what streaming device or what input you want into your flat screen. Easy. It's really easy. But a lot of people, I know it's new technology, and they don't understand it, right? So now, I'm going to show you a little bit about Roku. And in order for me to do that, I have to switch your cameras. I'm here alone today, and I'm working with two cameras, so I'm going to be switching the cameras a little bit around here. So be patient with me. Okay. So with our remote control, we have a home button. And if I press that home button, it brings me to this screen. And if I scroll down, you can see all of the various content. A lot of this is free, some of which Hulu you have to join. You can get Netflix on this, but you can get YouTube also. The one I want to show you today is PNN, KLPS-19, Proud TV. Just click on it. And the main menu comes up. And if you scroll down, you can see Stuck in the Middle by Alan Edwards. And you can see our cartoon channel, our movie channel, and you can see our retro Poptro TV channel. Again, I'm trying to adjust it so that you can see all of it. Maybe a little bit lower here. Okay, and then in the main menu on top, right up here, you have the Ozzie Harriet Show, the Lucy Show, What's My Line, Three Stooges, Andy Griffith, Dick Van Dyke, and it goes on and on and on. So let's watch Dick Van Dyke, and we will resume. And it's just now loading up. And you can see your favorite Dick Van Dyke show streaming live directly from Palm Springs. Okay? So that's Roku. And that's what I wanted to show you today, is how simple it is to use this device. And how much content you can get. Hi, I see Helen's out there. I see John's out there. Jimmy's out there. Great. Nice to have you join us today for Season 3 premiere. Okay, so that's technology. Streaming devices. Easy to use. Have your children, grandchildren help you if you need help, or friends. Again, you can save a lot of money by disconnecting your cable and just go with Wi-Fi programming through streaming devices like Roku, Chromecast. They now have Apple Plus and Disney Plus. So there's so much out there that you can watch on demand. You can also join through Roku. I believe it's also available on Chromecast as well, but I know it's available on Roku for $29.99 Sling, which will give you all of your regular programming that you're used to seeing as well. So again, check those all out. PNN Media is on Roku and Chromecast, and you can find the content easier by streaming it through one of those devices. On the PNN Plus mobile app, you have to search a little bit longer to find all of the information, but it's also always located there, and it's also always located at our magazine, PrideNation.com, as well as PNN.One. So PNN.One, if you type it into a web browser, will have all of our channels, all of our content there as well. So that brings us from talking about technology to now giving you an update on COVID-19. So today is September 13th, Sunday, and the startling statistics is we have over 6.5 million U.S. cases of COVID-19, and we have over 194,000 deaths in the United States. Now, recently there was a study that went back 3 years, and they looked at deaths and compared it to the earlier deaths this year. And through that kind of epidemiologic kind of study, looking at trends and causes of death, early on in the disease, there were no tests for COVID-19. So we know that December 31st was the first case reported in China, but it was probably in China earlier than that. And very early in January, the U.S. government was learning of a potential of a possible pandemic hitting the United States. And of course, we know that in February, early February, there were a lot of active discussions on how best to cope with COVID-19. We still have sporadic testing, and that's difficult, especially for people who are traveling between states, or people that suspect they have the disease and getting timely test results. And we have, unfortunately, no national COVID-19 plan. and that's where we stand today. A lot of the virus traveled from China into Europe, Europe into New York City, then throughout the West Coast, and then now into the Midwest. So the virus is definitely spreading. It's highly contagious. I think we're all familiar with the immediate symptoms of fever, cough, sore throat, pneumonia, diarrhea, muscle aches, and 85% of the people generally recover from these symptoms, and about 15% have to be admitted because of difficulty in breathing, shortness of breath, lack of oxygenation, and severe pneumonia. Now, there are also long-term complications that we still don't completely understand. So I have a personal friend. He's young, he's healthy, he's thin, he doesn't have any comorbidities like hypertension or asthma. He did contract the disease. He had 7 days of symptoms, and weeks afterwards he was still having some confusion. Some people refer to this as brain fog. So we know now there are long-term complications of the virus. We also know that there are asymptomatic carriers of the virus. So there are people that for whatever reason do not develop symptoms, have the virus, and can spread the virus. Children are a good example of this, but there are adults also that are asymptomatic and can spread the disease. This is probably all a review for all of you. And the only active treatment, and you can't even call that an active treatment, but the only measures that we can take according to our public officials and our scientists and our medical doctors is to wear masks and practice social distancing and stay home as much as possible. Because we do know that large crowds of people spread the events. People who do not wear masks spread the disease. People who project their voices loudly or sing loudly, especially if they're not outside, spread the disease. So we wear the masks to prevent the spread of the disease, but also to obviously protect ourselves. So I know there's a lot of cavalier people out there that feel, well, if I get it, I get it, and so forth. But remember this, there are long-term complications. There is a mortality rate associated with COVID-19. It's somewhere between 3 to 4%, and is a crude mortality rate because we don't actually have the appropriate denominator. We think there's actually 45,000 more deaths than 194,000. And that's by looking at previous years and comparing it to early this year. And even as far as how many cases we have, not everyone's been tested. So we don't know the numerator that well as well. But when you calculate a crude mortality rate, it's approximately 3 to 4%. It seems to be getting lower because our healthcare professionals understand better about early recognition of the disease and understand better about using drugs like remdesivir, which is really the only proven antiviral agent we have against the virus. For the very sick patients, they get 5 days of remdesivir, and that shortens their hospitalization stay by 4 days. It hasn't been proven to reduce mortality, but it has been proven to reduce hospitalization days. And the second drug that we have is an old drug that's been around forever, Dexamethasone. People know that by Decadron, and it's used for everything from managing severe allergic reactions to downregulating your immune system to fighting pneumonia and so forth. And that's been proven to be effective for the very sick patients that are having pneumonia and are hospitalized. Okay, so just going back over those numbers, 85% of these people with COVID-19 tend to recover within 7 to 14 days. 15% are severely ill and are hospitalized. And the mortality rate, which I say is the crude mortality rate, is somewhere between 3 to 4%. And in this country, we have at least over 194,000 deaths and possibly an additional 45,000 if you look at that epidemiologic study that was recently published, and I believe it was in the New York Times. And those were people that died of pneumonia, say, but they weren't tested for COVID-19, and they looked at recent years previous to this past year, and they figured out there's probably an additional 45,000 deaths. So a lot needs to be done with regards to treatment. We need to find additional antiviral agents that could be used to treat the disease earlier, more effective maybe in preventing the disease from ever happening. And a lot of work needs to be done with regards to additional treatments for COVID-19. And there's a lot of work that is being done by scientists and medical professionals throughout the world. So let's hope we can get this under control. Now let's talk about vaccine development. Now, HIV has been around for 35 years or more, and with HIV, we were never ever able to develop a vaccine, and that's true with other viruses, and it's because that HIV virus mutates so quickly and so fast. It's also the reason why we get a flu shot every year, because the flu strains change, mutate, and additional vaccines are needed to be made in anticipation of what we think the most likely strains are to come to the U.S. for flu seasons. And it is time right now to also get your flu shot. So you don't want to miss your flu shot this year, because God forbid you come down with both the flu and COVID-19. It's going to be a very difficult flu season for everyone, and obviously COVID-19 is not going away. And a lot has changed. I remember doing the first Pharmative live from the location of one of the first reported cases in Sacramento, and we were just talking about, a few cases back then, and now we're over 6.5 million cases. So a lot of work needs to be done with regards to treatment. Preventative treatments, early treatments, and even treatments for those that are severely ill with COVID-19. But right now, all we have is remdesivir, 5 days of treatment, and dexamethasone. Hydroxychloroquine, which was promoted by politicians, does not work and is not being further investigated, has drug interactions, has cardiotoxicity associated, especially in combination with azithromycin. And hydroxychloroquine, which was promoted by, again, politicians, not by medical scientists and public officials, actually interferes with the efficacy of remdesivir. So hydroxychloroquine is toxic, it doesn't work. And oleander, oil from oleander is toxic and does not work. So there was some hype about that as well. Again, that is just snake oil. So what I highly recommend is for you to talk to the medical professionals, the scientists, the public health officials, and look to them for the information about what's effective and what's not effective. Okay, so let's now talk about vaccine development. There's a number of different vaccines being developed around the world, but the 3 top ones that I'm going to discuss with you that are furthest along in development and are in phase 3 studies is the vaccine by Moderna. Okay, now Moderna is having a difficult time in enrolling diverse groups. And what I mean by that is, looking for Black people, Asian people, Hispanic people, Caucasians, okay? So we can understand the safety and efficacies in these subgroups. also looking at age, older versus younger, and also looking at people with comorbidities. And we know that people with diabetes and asthma and heart conditions and hypertension, obesity, those people are at a higher risk to developing serious complications from COVID-19. So with a 30,000 patient trial through Moderna, we are hoping to learn vaccine versus placebo. We're hoping to learn not only is that efficacious, and by efficacious we're talking about, a 50% reduction in COVID-19 positivity rate. So you're protecting 50% of the people with the vaccine or higher. 75% would even be better. And we're also talking about safety. So we want to make sure that the vaccine is not associated with serious side effects. All right. Now, every phase 3 placebo-controlled trial has what they call a data monitoring committee. Sometimes this is referred to, the old term is called data safety monitoring board. They're the same thing. It's an independent committee from the investigators who are conducting the study. And they periodically will look at the unblinded data for safety and for efficacy. Sometimes there are early stopping criteria. So if the drug is extremely effective after only enrolling, say, 15,000 or 20,000, and the drug is safe, they might stop the trial early, and they might say, okay, this needs to stop. It's a great drug. It works. And we need to make this available as soon as possible to the public. Okay, so the DMC is primarily looking at safety and possibly early stopping criteria of efficacy. All right, everybody else is blinded. The doctors are blinded, the clinical scientists are blinded, everybody is blinded. Nobody knows whether they're getting the placebo or whether they're getting the vaccine. And the reason why we do it this way is it minimizes error in the conduct of the study. That's the easiest way to say that. So you don't know. So nobody knows if the Moderna vaccine works. We're hopeful because of the phase 1-2 studies. We are hopeful of the research that has been done to get to the phase 3 study, but we don't know the outcome and the results of the phase 3 studies. And I have to tell you, having been in clinical development for over 25 years, I realize that a lot can go wrong in a phase 3 study, and you never know what the results are going to be until you finally go through the unblinding procedures that are necessary. So once you hit your enrollment goal, they unblind the study. The statistician runs all the data tables and all the data graphs. Now realize, once the subjects are enrolled, you have to wait and follow these patients for events. In this case, the events are COVID-19 positive events, right? So they get their injections. In the Moderna case, they get 2 injections, and then they're placed out in the natural environment that they work and live in, and they're followed up periodically for assessments. And sometimes it's blood collection, sometimes it's testing for the virus, and so forth. All of the data, and I have done this, on 30,000 patients, row by row by row, by patient by patient by patient, has to be data cleaned. And why is that? Because when the data is entered into the database, sometimes mistakes are made, and it creates questions because there's a disconnect between one data variable and another one. Then a question has to go back to the site to answer that question and to correct the data if it was not entered correctly. That takes a long time. But once all the data is finally cleaned, and the next step is to go through the unblinding procedures. This is appropriate study conduct. The data tables are generated by the statistician, and then the data is reviewed by the company and then by peer-reviewed scientific congresses, peer-reviewed journals. And while this is all happening, An application is being placed with the FDA or with the European agency or with the Japanese agency. Every country has different regulations. These applications include all of the animal data, all of the phase 1 data, all of the phase 2 data, phase 3 data, the answering of basic general questions regarding, the safety profile, the efficacy profile. A label has to be created that comes with the drug. And in that label, it tells you how to administer the drug, what the side effects of the drug are there black box warnings, here's the clinical efficacy data, what are the drug interactions, and those can all be accessed by drugs.com at the FDA. So a lot of work has to be taken from peer review of the data, and I'm sure there's going to be review and comparisons, indirect comparisons between, say, for example, the Oxford AstraZeneca vaccine, the Pfizer vaccine, the Moderna vaccine, and then it has to go through the approval process. Now, if for any reason there's early stopping criteria because the drug is shown to be effective, it's possible it may be available through a national emergency protocol. That's possible, but it's not the most rigorous process of scientific review. And they did that with hydroxychloroquine, and it was found not to work, and it was toxic. And Brazil bought a lot of hydroxychloroquine, and the United States bought a lot of hydroxychloroquine, and there were shortages of hydroxychloroquine for those patients, that use it for malaria and lupus and a number of other indications as well. And the drug doesn't even work, and it actually reduces the effect of remdesivir. So that is really the main reasons why we want a rigorous review of scientific data with regards to a vaccine for COVID-19. So 3 companies, Moderna, which is enrolling patients but having difficulty in enrolling minorities. The Pfizer, the last report I read was they have 25,000 patients enrolled. Their goal is to have 30,000 patients, and they may have data by the end of October. Now, as you also know, the AstraZeneca Oxford trial was stopped for inflammation of the spinal cord, a serious adverse event in 1 patient. They had to evaluate the cause. Was it the drug causing it? Was it something else? The severity, the seriousness. My understanding of that is that the patient is now doing fine and it reversed. So the trial is now continuing and enrolling. So, as it stands now, we have no vaccines that have been demonstrated in phase 3 trials to be safe and effective as of now. And it's really unlikely that we wouldn't have anything until next year. That has gone through the rigorous scientific review process. Remember what I've always said on Pharmative Live, we've got to weigh the benefits versus the side effects, the risks, and of course the cost, because some of these drugs can be extremely costly, and whether the insurance companies will cover this or not, or whether you're uninsured or not. More and more people are becoming unemployed, and they're losing their insurance benefits, and our president is actively pursuing dismantling Obamacare in the courts right now, and to my knowledge, there's no Trump health care plan. So in the middle of a pandemic, a lot of people are uninsured. So the question is going to be, who gets the vaccine first, and how much is it going to cost you if you're not insured? So lots of questions to still remain. I know this is very political, but it shouldn't be. It should be based on medical science. It should be based on the subject experts, the scientists out there, and the public health officials, and not the politicians. And again, I think that it's really unlikely we would have a vaccine available by the end of the year. The only way that is possible is if they rush the process and make it a national emergency use protocol. And I'm not sure, if I don't review the data, I'm not sure I would be taking that vaccine right away. But rather, do what we know to do is stay safe, stay home as much as possible, wear your masks, and practice social distancing. And if you think you're positive, self-quarantine yourself for 14 days. Okay, so now I'm going to conclude with an endorsement. PNN Media Group endorses Joe Biden and Kamala Harris for President and Vice President for the 2020 election, which is held on November 3rd. And I think that Joe Biden and Kamala Harris will develop a COVID-19 national plan, which is absolutely necessary. I think they will make America better. They will provide better jobs. They will work on a cleaner environment. And I always say, in order to have a healthy economy, you need healthy workers and you need healthy citizens and customers. And so we have to address COVID-19 as quickly as possible. We have to ensure the health of Americans. I understand the frustration of small business owners who are losing their businesses, who are unemployed, but we have to open up our businesses, our schools safely. And if we don't, we're going to go from 194,000 deaths to 250 or 300,000 Americans dying from COVID-19 because there's no national plan to include mandatory masks and mandatory social distancing. And unfortunately, there are politicians that are conducting spreader events, and those events have been linked to increased cases and increased deaths. And in fact, I forget his name, but the founder of Godfather Pizza, who's a Republican, went to the Oklahoma event for the Republicans and unfortunately contracted the disease and died shortly thereafter. So no one is immune to COVID-19, and PNN Media Group is proud to endorse Joe Biden and Kamala Harris for a better America, a better economy, better jobs, a national health care COVID-19 plan, improvement in public education. I have no doubt that Joe Biden is a Christian, a true Christian, a deep man of integrity and honesty, surrounded by subject experts all around him, and he will put together the best team possible, because this country will not survive 4 more years of Donald Trump, who has committed more crimes than any man in this country, and whom I consider to be an illegitimate president because he colluded with the Russians. Paul Manafort was put to jail for sharing, for many, many reasons, but he was sharing polling information with the Russians. Donald Trump has had many conversations with Vladimir Putin, and those conversations are unknown. And Putin is basically telling Donald Trump what to do. And Putin is paying the Taliban to kill American soldiers in Afghanistan. And all of these things are moving us from a democracy to a dictatorship. So this is the most important election of our lives. You know, if you follow me on Facebook or Twitter or Instagram, you'll see I post a lot about PNN media and health topics. But my second topic is politics. Okay, and this is the most important election. I understand people want lower taxes, but I also understand that from the right-wing radical groups, they are causing riots. They are distorting truth and distorting facts. Defunding police is not about taking away our policemen and department. It's about reaching out to the community, taking some of that money so that the officers are becoming part of the community, as well as having police officers when there's criminal activity that needs to be. But Black lives do matter, and there's a movement and a strong movement, and we will prevail. Global warming is real, and our president denies that. Our president is actually deregulating environmental restrictions so that businesses can make more money while we are destroying the planet, because the temperature is rising, there are more wildfires, the seas are rising, there are more powerful storms, and in order to reverse global warming, we need to move to green energy. That's why myself and my partner have solar panels to panel our house, and we have an electric car, and we have basically a carbon footprint neutral for our home with green efficient appliances. And everybody should work towards those goals so we could replace fossil fuels with green energy. And in fact, one of the things I'm most proud about, and I know we're over time, but is Palm Springs has almost 4,000 windmills, enough windmills that powers the entire Coachella Valley. That power actually is pumped to Texas for sale down in Texas. But it does produce a great deal of power. And what we need to do is replace fossil fuels with windmills and solar panels and other efficient ways of generating power without causing environmental pollution and global warming. So there's no choice in my mind. Vote for Biden and Kamala Harris. You won't be disappointed. It will be a fantastic presidency and vice presidency, and there is hope that we can turn around the self-destructive behavior of Donald J. Trump, who really should be held accountable to the laws of this country. So when he breaks the laws, which he has broken so many laws, it's hard to keep track of, he should be held accountable, whether he's president or not. Okay? So start reading those books. There's a couple good books by Bob Woodward out there talking about COVID-19 and what the president knew early on in early February. There's a new book called Compromised, which talks a lot about the investigations into Russian collusion with the 2016 elections and the fact that is happening now. That's why I post a lot about politics, because I'm competing with all the Russian chat bots out there. So keep sharing those things around, because most of what I post is absolutely based on facts. And so we need to move on, and we need to have hope in this country. So we need to vote blue. We need to get the vote out. And if you need information about voting, go to the website vote.org. That's vote.org. And that's it for today. We're over time. I will see you next week, because Pharmative Live is back with Season 3. We're going to have some exciting new episodes. And I could tantalize you with a few, but I think the next topic for next week will be modern day cults, and it'll be a 2-part episode. So you want to stay tuned and hear about that. And these videos are all available afterwards on YouTube as well as on Pharmative.com for replay. And I'll see you next week. And I always end by saying stay healthy, because it's easier to prevent disease than to treat illnesses. So with that, I'll say goodbye, and I'll see you next week.